Good afternoon and welcome to the Federal Executive Forum celebrating 21 years of profiling excellence in government IT mission programs. I'm Luke McCormack. During today's show, we will discuss critical issues facing government and industry leaders and using information technology to improve healthcare and healthcare services. With me on today's show are Pat Flanders, Chief Information Officer, Defense Health Agency, Molly Prieto, Principal Deputy Director, Office of the National Standards, Certification and Analysis, Office of the National Coordinator for Health IT. Catherine Weatherby, Acting Director, IT Planning Group, Centers for Medicare and Medicaid Services. Ben Cushing, Chief Architect, Health and Life Sciences at Red Hat. Kim Kilty, Senior Manager, Federal Civilian at Cloudflare. And Egan Rinderer, Senior VP, Global Public Sector and Commercial Enterprise Growth at Ninja One. Pat, we're going to start with you. I know the mantra is keep it boring, keep it simple, make it invisible. We know it's not boring. We know it's not simple. You've been up to a lot up there. Give us a state of how things are going in regards to the push forward with health IT with all this emerging technology in play.
Yeah, it's a good time to be CIO, Luke. Several initiatives over the last 18 months have proven to be really exciting. First is our new ambient listening capability. So it is a capability integrated with our electronic health record system where clinicians can record conversations with patients. And when they're done, it creates notes that utilizes artificial intelligence, and it saves the clinicians a ton of time, which equates to seeing more patients and less errors. So that's a big one. Another is Secretary Hegseth announced a DoD-wide capability for AI. It's called Gen AI, and it's accredited for everything except personal health information. But it's been really a game changer because there's no limitations to it, no token issues, and you can use it for a lot of the administrative features, functions in the hospitals. And then on the heels of that, we have our Ask Sage LLM implementation, which is the only LLM accredited for protected health information. And so I'll talk more about that later, but that's really been something that the clinicians can use in an unconstrained way with PHI. On the operational front, there's a lot going on with our JOMAS program. That's our operational electronic health record system. That's what goes on ships and out in the battle space. Lots of good initiatives there, and incorporation with War Data Platform, which is the DoD's data repository and data orchestration engine. A system called Paratus that's in the works. That is a system that's attempting to kind of normalize all the functions of readiness across the Army, Navy, Air Force, all different to now. And then finally, a system called Hypori, which allows us to do basically VDI of a government cell phone. And that's important because we can only use government cell phones, accredited government cell phones with PHI, patient information. But what this does, because there's nothing on the phone, it actually allows you to use a personal phone and a VDI image to do that, which is going to increase our ability to use ambient dictation and all these other features that we spent so much time trying to accredit.
A lot of great technology going on in the front of the house and the back of the house, and we really appreciate the description of all this emerging technology to really enhance the capabilities there, both with the patient and with the clinicians. So hats off to DHA. Molly, it's all about standards. There's a lot of data going back and forth. I know this is your favorite subject, and it's a super important one, right? I mean, everyone's had the frustration of, being at one clinician, being at another, can't get the data. Tell us about what's the state of the state in the environment that you're working in.
Absolutely. And if you remember, standards are my favorite topic.
Yes,
Um,
yes.
no, so there's certainly a lot been happening over at the Office of the National Coordinator. Pat mentioned a lot of, tools that DHA is using that is helping better serve their patients. And a lot of that technology is grounded in, work that ONC has been doing to make sure that that technology functions the best way for both the patients and the clinicians who are providing care. And like you mentioned, Luke, to make sure that that information can be shared if someone is receiving care elsewhere. So if they have an emergency at a civilian hospital, are they able to get that information to the provider providing care there, in real time to make sure that their allergies are available, their medication lists are available. So one of the exciting things now that we're in halfway through 2026 is that we have some rules that will be coming up more quickly. Perhaps when I say 2027, it seems like a long way away, but with how quickly 2026 has gone by, we'll be there before we know it. So by the end of 2027, ONC certified electronic health records will have to be able to support electronic prior authorization. That's been a big
Mm,
priority in this administration, making sure that those prior authorizations that go between the clinicians that are providing care and the payers that are covering the patients, that those can be more seamless, reduce burden on both sides. And so by the end of 2027, they must be using electronic prior authorization capabilities, which we expect to save a lot of time. And over the next decade, we expect to save about $19 billion in labor costs. So that's a really exciting area. We've been doing a lot of work with our partners at CMS to do testing and to be ready and to make sure also that our regulations across ONC and CMS are moving toward that same goalpost. Um, Additionally, by the end of 2027, those same ONC certified EHRs will be working on patient-specific real-time prescription benefit information, which also means that as a patient, if my provider is prescribing a medication, they can see what the formulary status is, what an out-of-pocket cost might be for me, and then other lower cost clinically appropriate alternatives. So really giving some more ability for the patient to be able to make informed decisions, understand what their costs might be. As someone who is on some rather expensive medications, I'm really excited to be able to, be in that position to say, actually, let's do this one instead of the one that I've been on. So those are some really exciting deadlines that are coming up in 2027, and lots of opportunities to test with us. So I'll throw that out there if folks are interested. We'd love for you to join us. Lots of opportunities also to do some pilots. We're working very closely with HL7 Da Vinci and some of our other standards development partners to make sure that those standards are ready to go, and that we're really being iterative and consensus driven as we're moving towards those deadlines. So those are some of our top things that are bringing us excitement this year.
lofty goals, and appreciate you all sort of putting the mantle down and a stake in the ground. 2027, no longer a black box, right? Transparency is key. Those standards are so important, and appreciate all the testing that's going on as well to make that a smooth transition. Catherine, you can't do any of this unless you plan for it. Give us a state of the state as to how things are going over there in your organization.
Well, CMS is really excited about all of these new standards and the way that we're addressing care and clinical care for our patients. As everybody knows, CMS really cares about making America healthy again, and we want to ensure that our patients have access to the best healthcare, as well as access to the payment models and ways to, although we're putting together all of these standards, and we're doing some new ideas with clinical care, it has to be paid for the clinicians to actually move forward. So some of the stuff that I want to remind people about is, telemedicine. I realize that everybody relies on telemedicine at this point, but it really became popular in 2020 during the COVID area. And
Mm-hmm.
so during COVID and really expanding telemedicine has allowed us to move out into rural areas as well as some of our underserved populations and really start looking at whole health care. And so moving away from just the typical fee for service type of models that we've looked at across, for decades, and moving into that value-based purchasing that you hear so much about. So it's really important as we as we look to our future, we have things like the access model coming down, which is looking at different ways of monitoring and overseeing patients from a remote monitoring situation and ensuring that they have access to continuity of care. The other thing that we're looking at is really moving forward with making all of these standards necessary so that all of our payment structures and working with all of our payers is, they're all moving in the same direction.
It's all got to stitch together, and I really do appreciate the role healthcare play and the IoT devices, right, that are available now for this telemedicine. It's really just sort of unlocked a lot of capability that I think is super important for those that just don't have the capability to get access to the healthcare to really get premium healthcare right in their home, so to speak. Ben, Red Hat, you can't do all this capability without having sophisticated technology. You really need to make sure it's secure and it's in environments that can scale, etc. Insert Red Hat. Give us a state of the state as to where you all stand in this tectonic movement to provide this type of capability to millions of individuals.
Yeah, there's really three new major risks that
Hmm.
we're handling across the world, regardless of healthcare. The first is post-quantum cryptography. So for those who don't know what that is, essentially quantum computers are at the precipice of being able to crack any sort of uh, encrypted data. So data at rest and data at motion. And they're this is really Y2K times 10, just not to alarm anyone. But the overhaul that has to happen across all of the IT systems over the next several years is substantial to meet this rather existential threat. So we're really gearing up for that. We're working closely with DISA and NIST to make sure those algorithms are available to everyone, and distribute those through the usual IT channels. So for the most part, this would all come through Linux distributions. But that's like a really big issue. The second has been making news lately, more so than post-quantum cryptography, which is the release of Mythos. So, Mythos is a very, very powerful large language model that's capable of stringing different critical vulnerabilities that are found in software to create attack surfaces that we never could have imagined as human beings. And there's a huge consortium of IT organizations that are coming together to try to patch the internet, essentially. We have, for about 30 years now, been building up all of our IT systems on top of open source, which is still arguably the most secure way to build software. The challenge with Mythos is that it is capable of cracking open a lot of these systems. And so we're actually meeting that head on. So Red Hat itself, we're dedicating $5 billion and 20,000 engineers specifically to target open source software vulnerabilities in the entire ecosystem, regardless of whether it's Red Hat open source or not. I would say also the attacks on the software supply chain is really large inside of healthcare specifically. So like ransomware is the number one threat vector for any healthcare organization. We're working really hard to secure that supply chain across the board, because that's largely how these threat actors are gaining access to medical records and then locking them all down with cryptography, and then, of course, demanding ransom from the organizations themselves.
Hmm.
So we're working to make sure that doesn't happen, obviously. There's only so much you can do to harden production. I think we've sort of reached a plateau in that space. Um, what we're focused on now is how they're actually getting into these systems through supply chains. So that's a major focus for Red Hat.
Hardening these environments, super critical. Insert Cloudflare, part of that hardening. Kim, I know there's a lot of work going on here. Healthcare data being some of the most sensitive out there. Give us a state of the state as to where Cloudflare is positioning themselves here.
Yeah, I think what we're seeing is, healthcare, IT, and really the entire federal government, from what we see, is moving through two massive transitions at the same time. The first is really moving from single centralized cloud providers or data centers to more distributed multi-cloud environments. The second is, of course, the rapid adoption of artificial intelligence, which is like for everything from clinical decision support to patient scheduling. The problem is that security and data governance were kind of built for the old model, right? One firewall, one building, one controlled entry point. And that architecture doesn't really work when your clinicians are on mobile devices now, data lives in multiple clouds, and your patients are accessing care from home, from military bases overseas, or from rural clinics. So the trend we're seeing is that healthcare organizations aren't just moving data to the cloud, but they're actually moving secure access and intelligent processing to the edge. So closer to the patient, closer to where care is delivered. Because it doesn't really matter how powerful your clinical intelligence is if it lives in a data center that's across the country and a clinic can't get real-time answers. When we talk about distributing infrastructure everywhere, you are getting much closer to the population that the care is being delivered to, and just making real-time data available for patient triage, critical decisions actually usable. Obviously, speed means nothing if it isn't secure. So as data is moving out of centralized warehouses towards the clinician, you want to verify every identity, encrypt every connection, and inspect every interaction. Our network recently absorbed millions of attacks in a single day against a nationwide medical system without any disruption to their public-facing patient portals. So by stopping the attacks immediately at the edge, we free up a lot of infrastructure resources and remove kind of that noise that clogs systems and often creates strain on the good traffic as well. Like federal agencies really need that same resilience.
Delicate balance to, have the flexibility to make it available, but absolutely need to make sure it is secured. Egan, how about at Ninja One? Well, tell us about Ninja One. What is Ninja One? How do you fit into this?
When you opened, you said something about the normal mantra is to be boring.
Right, right.
Yeah, that is kind of our mantra, right? We want to be invisible. Our job, our purpose in existence is sort of to make the back end supporting infrastructure that any professional uses, whether it's a clinician or a business person, whoever it happens to be. We want to make the technology that they rely on completely invisible. In other words, they do their job, the technology does what it's supposed to do, and they sort of forget that it's there. They don't have to think about it because they can just go about their business. I think that's particularly true with clinicians, where the more time they are focusing on the patient, the better the outcome's going to be. It's pretty simple math in that regard. And so what Ninja One does is, we're a unified endpoint management platform, but we try to bring next generational thinking to that. There's a lot of tooling out there that does things that we do. Our goal, and it's actually in our name, the reason that we chose the name for the company is that we wanted to be behind the scenes, invisible like a ninja, right? It's a little bit gimmicky, but that is our heritage,
No, I like
right?
it.
Yeah. And so if you think about this from the perspective of healthcare, there's a million-ish beds in the United States. There's about anywhere from 10 to 15 devices, connected devices associated with each one of those beds. Those all have to be managed. The clinician has to be able to rely on those things. They just need to work. And the clinician should not be, their work should not be impeded by us needing to manage those things. Along with that, we have to keep them secure. We have to keep them up to date, all the things that you need to be able to do so that the work that is happening behind the scenes is truly invisible both to the clinician and the patient, and we can not interfere with patient outcomes. That's ultimately why we exist. And so we take a very pragmatic approach to that. Our goal in life, our engineers are sort of hyper focused on how can we compress the timeline necessary to do the things that need to be done that could be disruptive on the endpoint. Because let's face it, there are a lot of sort of competing priorities there. If you look at the new binding operational directive that was released on June 10th, the CISA has now accelerated time to patch on the top, call it 1% of critical vulnerabilities. From originally it was 30 days, then they compressed it to 2 weeks. Now it's compressed to 3 days, 72 hours. That is doing things in the legacy way with legacy tools and adhering to legacy change management processes. That's a recipe for disaster. A lot has to change in order to meet that. That said, it's the right decision. CISA did the right thing here, but I think the onus is now on us as the vendor community to work together with our government counterparts to say, here's how we can meet those new requirements in a responsible way, and in particular in this setting, in a way that doesn't interfere with clinician-patient interaction. That's sort of the ultimate goal here, and something that we
Amen.
need to work very hard on.
Absolutely. Amen. Let's let the patient be the patient. Let's let the clinician be the clinician, and keep it secure and available. We really do appreciate that. All right, we're going to take a short break here. We're going to be right back. You're listening to the Federal Executive Forum on Federal News Network. Welcome back to the Federal Executive Forum on Federal News Network. We are talking about healthcare IT, all things healthcare IT. Pat, I'm going to start with you. I want to talk about a specific program you'd like to highlight over there at DHA.
Well, sure. 24 months ago, I had several general officers that were network directors just pleading for any capability that was AI enabled to help with patient flow, backend, and ambient dictation. And we just, the long pole in the tent for us was getting it accredited to Department of Defense standards. And so what came out of that was our Ask Sage implementation. It is an LLM cleared PHI that took us about a year and a half to accredit. It's our own tenant. But what's really unique about it is it's not one vendor, one model, or their set of models. It allows us access to the models of about 20 different vendors. And so you can ask it a question, change the model, ask it another question, get different answers. And that's been really, really helpful.
Super powerful, it sounds like, and I'm sure they are really enjoying that capability that you're delivering to them there.
Yeah, we used it during Epic Fury. They were actually using it to track patient movement. And there's a very complex calculus of mode of transport, where people get dropped off, what the injuries are, and it really helped us integrate data from multiple sources using that AI.
Love it, love it. Kim, how about at Cloudflare? You have an opportunity to look across the agencies, quite frankly, the private sector as well. Give us an example of a program you'd like to highlight.
Well, I think one of the most critical things we do across the board is for healthcare is preventing healthcare fraud. So I think we all know a stolen credit card can be canceled in 5 minutes, but a stolen medical record lasts forever. So right now, I mean, the landscape's changing, right? You have AI bot armies that are attacking healthcare infrastructure at a scale that far outpaces human hackers for the first time in history. So they are automated, adaptive, and specifically targeting patient portals, provider logins, and claim systems. And the reason is really because a stolen healthcare identity is worth more on the dark web than a credit card number. So it's critical more than ever that correctly validating who gets access to private healthcare data for both providers and patients at this time. And it's not just about blocking malicious traffic, but it's also about distinguishing legitimate people and patients that are maybe refilling a prescription from maybe a credential stuffing bot that's harvesting VA benefits data, for example. So doing that without friction to the end user is really what we work on.
Appreciate that, and a super important element of this ecosystem. Catherine, specific program that you'd like to highlight?
Actually, I want to step back for a second and not just highlight one of the programs that we're doing here at CMS, because we're doing so much. I want to highlight the modernization we're doing. It is extremely
Excellent.
important for us to modernize these systems that have been around for so long and serve so many million Americans. And so I think that people hear about modernization, they hear about all of these new technical things that are coming down and how they're going to change the whole world. And that's a scary prospect. And so we're really taking modernization very seriously here at CMS. We're thinking about how do we continue to modernize at a speed that moves us forward, but still mitigates the risk and any errors that might be seen by the American people. We want to ensure that our systems are still working the way that everyone thinks that they should work, but bring in a lot of new ways of getting information. So things like identity proofing that we were just, Kim was just talking about. We're using Clear and ID.me and Login. We're trying to look at the digital experience and really think about the way that people see and log into systems in the private sector, and how can we bring some of that into the public sector to really make our systems much more user-friendly, and really take the advantage of capabilities that already exist.
Take advantage of those technological sort of user experience capabilities that certainly they expect and are used to in the private sector, and
Yes.
bringing it into this environment. I love that. Egan, how about at Ninja One, specific example that you'd like to highlight?
Yeah, I think for us, we're very outcomes focused. One of the more recent, we have a huge healthcare customer base in the commercial markets, and we have one very large nonprofit that we recently completed a rollout with. And if we look at outcomes, that's where the ROI comes from, right? We reduced for MDM onboarding of new devices, so they use a lot of mobile devices in the field. That sort of thing. We cut their MDM enrollment and disenrollment by 75%, just in terms of the raw amount of technician time that it requires, which gets devices into the hands of caregivers more quickly, and then deals with people leaving the organization or orphan devices, those sorts of things. The other thing that we were able to do was really focusing on the speed to which we can resolve issues. So think like mean time to resolution. MTTR now is taking them about 15% the time that it was taking previously. And that really is a byproduct of consolidating the number of tools, the amount of switching between tools they had to do. But if you think about that, reducing by 85% the amount of time it's taking on average to close a ticket for a clinician or a caregiver, that is a tremendous amount of time and money back that doesn't have to be spent on IT triage and troubleshooting, and can then be redirected into patient care, which that's the ultimate outcome that we're shooting for.
Incredible stat there, and very impressive. Love the fact that we're bringing that capability back to the hands of the clinicians. Molly, you put a stake in the ground, 2027. Give us a state of the state in regards to a program you'd like to just highlight, maybe something that's going on in 2026.
Sure. Let's talk about 2026 because we've seen some really exciting advancements in TEFCA specifically this year. So TEFCA is
what is it called?
Well, yeah, more acronyms. We love acronyms. So TEFCA, or the Trusted Exchange Framework and Common Agreement, which is our kind of national network of networks.
Okay.
And TEFCA has been around for quite some time, but this year we're really hitting some exciting milestones, and we are approaching nearly 1 billion exchanges on TEFCA. which is quite the exciting moment. So we expect that to come over the next few months. This is up from roughly 10 million exchanges on Tefka in 2025. So in just a year, we have made some really exciting advancements in that. And the thing that matters for the average, American citizen, the average patient, means that through Tefka, your information is more easily exchanged between healthcare organizations, between providers. And one of our national coordinator, Dr. Tom Keen's top priority is data liquidity. And this is data liquidity in action. So making sure that our information is available when we need it, where we need it. And another exciting, more recent live effort on Tefka is that the Social Security Administration is now using Tefka to be able to facilitate benefits determination. And so that benefits determination process that our friends over at SSA did could take weeks or months. And now we've heard on Tefka that it can take less than a day. So, really meaningful change and some really exciting future opportunities that Tefka could be used for as well, including payment, hopefully in the future. So lots of exciting things on there, and we'll have some sort of exciting celebration when we hit 1 billion exchanges on that network.
Wow, as a former CIO, these stats are really warming my heart. It's just super impressive to see this, and just knowing what a great user experience it becomes for all those that are in the ecosystem there. Ben, how about a specific program that you'd like to highlight
I'm
that you all
really
are working on?
I'm really excited about some of the edge capabilities coupled with MCP that we're working on right now. Just finished uh, doing a joint project with HHS, specifically CDC and NIH, where we actually built up some MCP servers to test out the viability of this technology for public health data. So one of the biggest challenges we see with public health research is extramural researchers not necessarily getting the full complexity of data they're going to work with. So they're usually missing a lot of the footnotes, the errata, and that they don't have like the context for the data. So they reach a lot of conclusions that are not necessarily grounded in evidence. And so what we've been showing is with MCP servers, we can actually replace the existing APIs, or at least from the front end to the extramural researchers, and give these researchers way richer context for them to work with the data. I think this could have a really huge impact on the way that we study diseases across the entire nation. And it's leveraging today's technology. It's very exciting.
Okay, let's talk about priorities. Catherine, I'm going to start with you. It's 2026. You're on a tear over there. Top priorities as you get through the rest of 2026.
Well, let's continue on empowering patients. Again, the digital user experience,
Love
making
it.
things much more clear for people. I can talk about when I was running healthcare.gov and the fact that, we really modernized all of the systems. We thought about how do people log in? How do people ask questions? How do we pull people through that experience in a way that makes sense for them so that they don't have to call someone or ask what's going on? We're really focusing in Medicare, again, about that user experience and how do people log in. We want it to be really user-friendly. We want people to feel like they can come here, they can understand what kind of services they can get, they can understand the options that they have for them. We've laid everything out very clearly around the tech, and moving forward in that way. And then on the payment side, we're really looking at future ways to, again, empower our patients, empower people to understand the information that they have, to understand why we've made the decisions that we've made, to really think about their health as whole health and not just, I went to the doctor because I had the flu. But when you think about diabetes care, how are we really going from being reactive to proactive in healthcare for the American people?
Excellent. I love it, and love the laser focus there. Egan, top priority Ninja One 2026.
Our real sort of maniacal focus right now is aligned with what I mentioned previously around accelerating the sort of the mundane tasks that we have to do to maintain the enterprise. When we're talking about having a requirement for example, for a 72-hour window to patch, right? That sounds sort of somewhat pedestrian. That's an incredibly difficult thing to do in large scale. Because of the risk that's incurred, like there's risk to having the vulnerability unpatched. There's also risk to patching too quickly because the patch isn't properly tested and your targeting can be off. There are all sorts of problems that can come into play. The larger the enterprise, the truer that becomes. We have a maniacal focus on incorporating very narrow AI or machine learning capabilities around buying down the risk and buying down the time simultaneously. If I can do both of those things, then I win the prize, right? Then I can say, look, you can safely patch in 72 hours with accurate targeting, and you're not going to increase your risk of causing collateral damage with a bad patch, something like that. It's a very, very difficult thing to do. Fortunately for us and fortunately for our customers, AI is incredibly well suited to solve a couple of those problems that can buy down from weeks of time to hours of time. And so that really is kind of our focus right now. And I think we're seeing a lot of success in that area.
Excellent, excellent. Molly, number one priority for you over there in 2026 as you finish out the second half?
Sure. I don't think I can pick one priority, so I apologize in advance, but I'll say our top three quickly. Leading the pack, we can say, is data liquidity, which I talked a bit about when talking about TAFCA, but making sure that that data is flowing, patients and providers have access to it. The other one is access and affordability. So making sure the technology has a purpose and that we're making, all using technology to ensure that patients can receive affordable care and that it's accessible to them as well. And then rounding out our top three is technology evolution. So making sure that we're being cautious about how technology is evolving, but also ensuring that all of those folks who need it, I know everyone's talking about AI. How can AI be used? How can it be used safely? And how can we make sure that patients understand how and where it's being used as well? So not one, but our top three would be data liquidity, access and affordability, and technology evolution. And we're really being thoughtful in making sure those are baked into all of the programs and policies that we're doing.
Thoughtful and laser focused. I love it. Kim, how about at Cloudflare? Top priority for you all in 2026?
Yeah, I think it's really just around securing innovation, right? So right now, everyone has a mandate to build or adopt AI. Our priority is ensuring that security isn't a casualty of that rapid pace of AI innovation. So any gap between adoption and governance is really where security breaches happen. So we work with organizations to kind of close that gap in three ways. One is just visibility, having a unified oversight of your artificial intelligence. Also automating content protection that's built for medicine. So tools that detect medical information. And then third, making compliance part of the equation, part of the foundation. Inheriting compliance from a platform that's already FedRAMP, for example, instead of launching a year-long compliance overhaul.
Absolutely, and very important, and we love the laser focus on that. All right, we're going to take a short break and we'll be right back. You're listening to the Federal Executive Forum on Federal News Network. Welcome back to the Federal Executive Forum on Federal News Network. We are talking about all things healthcare IT. We're talking specifically about priorities. Pat, I know you've got a tremendous amount of them, a dump truck load of them over there at DHA. Give us your top two priorities for 2026 as you round out the year.
So I've had this job 9 years, and I have never seen this level of emphasis on cybersecurity. The threat from AI is real, and this is night and weekend stuff. So very high priority. And then the second one, strategic alignment with the COCOMs. This administration, great emphasis on the warfighter and warfighting. So lots of things there, systems designed to optimize what's necessary for warfighting.
I love the laser focus. Very important. It's a 24/7 job, and hats off for you for your tenure there over at DHA for sure. Ben, top priority at Red Hat 2026.
Cybersecurity. I mean, Pat already hit the importance of that. The AI landscape is changing so rapidly. It's definitely the high priority. It keeps me up at night. I'm directly involved in it. I will say I don't want to lose track of some of the more positive strategic things. I
Sure.
think right now we have an opportunity to disseminate knowledge in a way that we've never had before. And what that looks like, the healthcare space, knowledge doubles every couple of months. And in the rural setting, just to Catherine's earlier point, the rural healthcare is actually really changing quite a bit thanks to AI. We can actually bring knowledge out to these rural settings and empower general practitioners with specific knowledge about how to treat, specialty care, and that's going to like really change how we practice medicine in a positive way.
Love it, and it's a important point, and I appreciate you highlighting and illuminating it. Well, I love this question, and certainly for our federal folks here that are landing 747s every day, as I like to say, lessons learned, right? Really important. Molly, I want to start with you. Just your, top lesson or two learned as you've been on this journey here, trying to move these mountains.
Sure. So this will not be a technology focused lesson learned, but I think what we've learned
Okay.
over the last few years has been the importance of trust. And to call back to TEFCA again, the T stands for trust. So the importance of trust in making sure that everyone who comes to the table, is at the table, has a seat at that table, is involved in the, determinations and the decisions and the development of the policy. So the importance of trust, of making sure that the technical components are grounded in governance and the human components and all of the, the fun legal components that come with that as well. But making sure that folks understand the end goals and the missions and feel bought into that along the way has been incredibly important for getting folks to feel comfortable to participate, particularly when health information is on the table. So everyone has been taking that really seriously in all of the work that we've been doing. And I think that's why we've been having such great luck in getting testing partners to the table for our future initiatives as well. So never want to forget the importance of trust and the human components and those strong relationships.
Great catch there. We really appreciate you pointing that out. Catherine, top lesson learned for you as you've been on this journey.
It's a reminder that technology is an enabler. We don't build tech for tech's sake. We build it because we're solving a problem. We're building it because we understand how people use our systems, where we want to move in the future. We understand like how we need to change data to enable AI or to enable TEFCA or to enable patients to have more information at the time of service. And so remembering that the tech is there, but the tech is there to enable all of our business, to enable clinical, to enable patients to have all of the information that they need. I get a lot of people that say, hey, I have this cool tech thing I want to build. And that's great. But we always want to remember that tech is here to enable us to serve America better. Tech is here to provide outcomes to the American people, not just to build new tech.
It's a very good point and a very good solemn reminder that let's not lose focus of the goal there for sure. Pat, quite a tenure there at DHA as you described. You've been on quite a journey. You've seen a lot of things. Top lesson learned that you'd like to impart some wisdom on this community, right? You've seen a lot there in that role.
So cyber can't be bolted on. You really it needs to be part of your design. That is one of the reasons we had such a hard time adopting AI, because none of the AI companies really made it the priority. We pulled it off. It was very difficult. On a positive note, one of the noticeable things I've noticed over the last 2 years is industry is now really taking FedRAMP serious. I mean, we're now seeing much more pre-approved FedRAMP High, IL5 type environments where 2 years ago you had to go sponsor them yourselves to get them there. So that's a good thing. And now what we really need is for the medical device community to kind of take that on, right? To start and have the focus not just be get FDA approved, but FDA approved in a cyber secure way. It's not acceptable to have your current product line still use Windows 10 and Windows XP.
Amen. And as a former one of the original JAB members, I think the federal government has made it a lot easier, or I guess a lot smoother, more predictable for said companies to get FedRAMP. So that goes both ways, I think, and that's been a bit win-win all the way across the board. All right, we're going to fast forward 2 to 3 years from now, and we're going to talk about what it's going to look like. Let's say 2029, which seems like forever. It really isn't. We blink, we'll be there. Egan, we're going to start with you. What's the focus going to be? What's the environment going to look like? What's in the petri dish today at Ninja One that is going to be widely in use 3 years from now?
Yeah, I think it's what you're going to see is a sort of this outsized impact from, I'm going to call it intelligent automation. We tend to throw that term around pretty loosely in the IT space. If I, build a save package and then schedule it, that's automation. That's not what I'm referring to. I'm referring to more intelligent automation that has some level of autonomy in it, in areas where AI can be trusted to sort of do what it does, come back, bring decisions to the human when there needs to be human interaction. This can have a tremendously outsized impact on driving efficiencies. The reality is IT teams are shrinking by necessity. It's been sort of this black hole for budget that just consumes everything around it. We can't continue doing that. I think people are aware of that. And this idea of intelligent automation is catching on very, very quickly. We're seeing it drive incredibly positive outcomes, talking about, some of that, like decreasing 85% of the time it takes to close tickets and things. That's directly attributable to what I'm talking about. I think you're going to see that grow explosively over the next few years and really have a dramatic impact on the industry.
Sure, and then allow those folks to continue to push up the value chain there. Kim, how about at Cloudflare? Again, we know there's a petri dish over there. You all are cooking some incredible things. What's the anticipation of what it's going to look like 3 years from now?
Yeah, I think nearer term, I think the biggest thing that we see is from a healthcare perspective is the end of like prior authorization nightmares. So today it can take weeks, right, to get a pre-authorization for insurance. We're working on agentic AI on our platform that completes all of that work without human intervention, 40% of the claims. So really big leaps right there in the short term. But longer term, I think it's not far-fetched that within our careers, especially with veterans and active duty war fighters that move between systems, that carrying your health identity with you, just like you do a mobile phone, maybe as an embedded chip, a secure credential, or like a walking EHR. I think the data eventually will stay with the patient, encrypted, zero trust verified at every touch point, but accessible to any authorized provider instantly, I think is what we're working towards.
Absolutely, and it sounds epic, quite frankly. Ben, Red Hat's been there, at the vanguard of open source, sort of on this journey. If we fast forward 3 years from now, what's that environment going to look like? Where's Red Hat going to be focusing their attention at that point?
Well, we're going to be right in the mix of the modernization for post-quantum cryptography. That's like just on the cusp of starting full force. That's going to be day-to-day activity with everyone here for the most part. I would say on the healthcare side, really to use the agentic AI conversation a little bit more. I'm working directly inside of HL7 to define the standards for how we actually automate healthcare itself. So the actual care that's delivered. How do we provide quality controls that are systems-based? So we can actually run those standards across the entire country. We're defining that now inside of HL7. That's actually going to inform directly the agentic AI systems that are then going to consume those standards in order to properly automate these processes. That's, for me, the most exciting work I get to do. I think it's probably have the largest impact as well. Just going back to the lack of specialty care, like a ubiquitous lack of standard practice across the board. Things like taking clinical best practice guidelines that are coming out of medical societies and turning those into processes that people can follow rote. That's the kind of stuff we're defining right now inside of HL7. These are new standards that are going to be very, very clear to everyone here, I hope. Hope soon ONC is going to be all over this. So we're just getting started now.
Really do appreciate and the participation that Red Hat has had on this journey. Catherine, you talked about a lot of interesting things and a solemn reminder that we're not doing IT for IT's sake. 3 years from now, there's going to be a lot more IT out there, a lot more widgets.
A lot more AI.
What's the state of the state at that point? What's the focus going to be?
I mean, I see AI continuing. It's not going away. I've
Right.
used it for years as predictive analytics on websites and other types of things. So the machine learning is there. The models exist. But where we're at is as we move from more like what I like to call reactive medicine, right? Going into the doctor because you're sick, to a predictive medicine, as a number of our colleagues on here have talked about. We're taking that information and we're moving it closer to the people that are making the decisions, trying to remove the friction from the workflows. But what that means is, just like Pat talked about not being able to bolt cyber on after the fact, we need to have governance in AI as part of the workflow and as we're moving forward. So I think that where we're going to be in 3 years and what we're going to see over the next few years is including governance early as a design philosophy. So humans are in the lead. We're using AI, we're having transparency. It's not this black box AI that people used to think of when they thought about clinical decision support. And it was like this black box of things that you didn't know what was going on. We're now taking all of that information. We're just like you see using large language models that you have now, where you have the recommendation, the data, the confidence level, right? All of those things come through when you use a large language model in your everyday life, starting to bring that into that healthcare workflow so that the people who are making the decisions can have those predictive types of analytics that are there based off of decisions that were made in the past, but can still have the ability to use the human brain to make the final decision. So how do we make, again, removing the friction, making our jobs easier, bringing all of that data to the forefront so that we can move faster?
Human in the loop, human on the loop. We really do appreciate that, and we look forward to that that environment that you're describing. All right, Molly, fast forward 2 to 3 years from now. I've invented a widget. I want to snap it into the ecosystem. Do I call 1-800-MOLLY? Do I get on my mobile phone and hit a button and poof, it's there? What do we look like 2 to 3 years from now?
That's some exciting technology. I like that. So a few of the folks already have talked about some really exciting things that we hope to see in 2 to 3 years. So Kim talked about electronic prior authorization, really removing the burden, removing the wait time. So that's definitely in our future, 2 to 3 years. I really hope that we're smoothing that process out, that the burden for the providers and for the support staff who are doing all of the paperwork now, that they're not faxing and they're not filling out the same forms over and over again, but instead that information is being pulled out of the medical record, being automatically sent, really taking advantage of those FHIR APIs and the really great work that HL7 Da Vinci has done to make that more seamless for both the, all ends, the patient, the provider, the payer. Catherine, you mentioned a lot about, really putting the information in the hands of the patient and making sure that the patient has some autonomy to make decisions. And so there's been a huge focus both at ONC and at CMS with the health tech ecosystem of making sure that patients are kind of the main provider of that information, that they have access to it, that it's on their phone, that it can travel with them. I really like the future Kim talked about too, of saying like, they can carry it around with them instead of it needing to arrive, at the provider's office. And so making sure that our some of our technology that is already in existence, like our G10 APIs and certified health IT systems, that those APIs are being used for patient apps and for making sure that the patient really has control of that data, where it's sent, when it's sent, how they access it. So I also think that in a few years, we'll be thinking less about how is our data being sent and is the right data being sent? Is that data of high quality? Are the folks who are receiving it able to use it? So I think we'll be able to move a bit more from is it getting to where it needs to be, and is the right data and is high quality data being where it needs to be?
Excellent, and we really do appreciate that, and we love that picture that you've painted there, Pat. You've implemented zero trust architecture. Quantum has been implemented or on the way to being implemented. I'm sort of describing this 2 to 3 years from now. What's it look like in your environment at that point? What's the focus going to be 3 years from now?
Well, I mean, at the end of the day, I think what you've heard already from the others, intelligent automation and sharing, but it's got to be secure as well. And
Hmm.
so, what I'd like to see, and I'm hopeful, is that we get advancements where AI can operate separate from the cloud environments, right? So disconnected AI. They have those today. So you think on-prem models that you train, and that will help a lot with the security of those kinds of things, make it more portable. And I think the commercial interest in that will be security, sovereignty of the disconnected nature of that, and then the dual use will be in the Department of War. We can use it in austere environments. So that's one thing. And then I think the other thing is a byproduct of everything we're seeing right now. Patients are super smart, right? They now are downloading their own medical records and uploading them into these LLMs and
Hmm.
really starting to manage their own healthcare. And so I think you're going to see like evolution where the tools get built more for the patients to empower them because it's just so powerful. You can download, the last 4 years of all your labs, and the AI will tell you things that the doctor didn't have time to spend with you to tell you. So
Really do appreciate that and appreciate everyone taking the time out of their busy schedules to join us for this program. I'd like to thank the sponsors for supporting us on the show. I'd like to thank the good people here at Federal News Network that make our program so successful and enjoyable. And most of all, I'd like to thank the listening audience out there that tune in every month. You've been listening to the Federal Executive Forum, part of the Federal News Network.